Hello, my name is Jenny, and I will be talking to you about the symptoms of PTSD. There are three main symptoms to be aware of according to the National Institute of Mental Health. They are re-experiencing, avoidance, emotional numbing, and hyperarousal. We will look at all of these a bit deeper. First, re-experiencing is having the experience that caused PTSD to occur, play over and over, like having flashbacks or nightmares. It can show physical signs such as pain, sweating, and shaking. PTSD patients might not be able to stop the negative reactions to the event that led to the change in the fight or flight response. Secondly, avoidance and emotional numbing is when the individual tries to avoid all emotion connected to the event that caused their PTSD. They try to avoid being reminded of the traumatic event and avoid talking to anyone about their experience. Many people with PTSD will even try to push the event out of their minds. They often separate themselves from the event with distractions such as work or hobbies. Third, hyperarousal is where a person is easily startled, can feel tense, or on the edge. Hyperarousal symptoms are usually constant instead of only being triggered by things that remind them of the traumatic event. Some individuals with PTSD may be very tense and find it hard to relax. This comes from the high level of anxiety that comes with the disorder due to stressors that will be discussed later. These symptoms of hyperarousal can cause the person experiencing them to have a hard time sleeping or falling asleep, cause them to have angry outbursts, can cause them to have a hard time focusing, and give them the constant feeling of being jumpy or uneasy. Symptoms of PTSD also have other kinds of problems that can include depression, anxiety, phobias, fears, headaches, dizziness, chest pains, and stomach aches that can affect their daily lives. Sometimes people with PTSD can have work-related problems and experience deterioration of relationships due to the symptoms and possible stressors that come with the disorder. Now that we have talked about re-experiencing, avoidance, and hyperarousal, Kelsey will talk to you about the stressors that can cause these symptoms. Kelsey?